One of our partners in the planning of this conference is a major organization, the American Psychiatric Association, which operates a special workplace mental health program. And it's officially known as the Center for Workplace Mental Health of the American Psychiatric Association Foundation. A lot of words. Maybe they need to work on shortening that. And anyway, I'm really pleased to be able to introduce two people, the director and the manager of this program. Shayla Garrity is the program manager, and Betsy Schwartz is the director of the Center for Workplace Mental Health for the APA Foundation. And they're going to enlighten us on how to change company culture based on their experience consulting with companies and with individuals who want to do this. So Shayla and Betsy, welcome. And maybe just spend a minute or two, if you could, just introducing yourselves, just to give us a better sense of who you are and how you get your sunshine and so on.
Great. Well, I'll be glad to do that. As you said, I'm Betsy Schwartz, and I have been at the foundation since last December. Prior to that, I worked for the National Council for what is now Wellbeing and led the U.S. operation of mental health first aid. Previous to that, I was director of the Mental Health America affiliate in Houston, Texas. So Shayla and I are both in DC in our office, which is on the beautiful new Wharf area in DC. If many of you are in DC, I think some of you live here, and we're excited about this opportunity to talk with you. So I'll turn it over to Shayla.
Thanks, Betsy.
Hi, everyone. My name is Shayla Garrity. I am the program manager. As mentioned before, for the Center for Workplace Mental Health, we are of the foundation arm of the American Psychiatric Association. So our colleagues work in other areas of mental health while we focus on the workplace. And I've been here about 2.5 years now, so still loving the work, still motivated, and happy to be here to share some of our wisdom with you guys.
Well, share on.
Amazing. So we have a presentation that I'm going to share with all of you. I will speak, and then I will pass it over to Betsy. Just sharing my screen here. All right. So, as we mentioned, we are focused entirely mental health in the workplace, as well as employee well-being, retention, all of that, helping organizations understand the intersection of mental health and well-being and how it positively and negatively affects the workplace. Obviously, there are a lot of different ways that it comes through the door, whether it be issues with performance or productivity. People may be missing a lot of work. Retention and recruitment are suffering. These are all things that we know we're battling against. And organizational culture, as you'll see there on the screen, and we've talked about a lot today, that is the big thing that we need to focus on moving forward in order to really improve things, improve each organization, and keep people happy and motivated around and keep doing what. One of the ways that we like to describe it, when employees are feeling pride in their work, they feel motivated, they connect to the purpose of what they're doing with the organization, they are much more likely to experience a better level of well-being, mental health, emotional health, physical health, all of it. When employees start to lose that sense of purpose, if they feel like they're stalling out in their work, they don't really see a direction, they're losing that motivation. where it's really critical for redirect the course for that employee, whether it be switching up the work, switching up the team, whatever it might be, but trying to get that person back engaged in the work before they progress any further, which can get all the way down into, as we call it, the valley of ill-being, creeping towards the negative effects of what it's like to reach levels of burnout at work, levels of dissatisfaction where you're despondent, you are losing that motivation in droves. And this is where it's a lot harder to come back from. So it's really crucial that employers focus on what they can do so that we don't reach these levels with our employees. Lots of people are doing research on this right now. I'm sure a lot of you have seen it out there. There are different reports. Betsy's going to really dive into the U.S. Surgeon General's report on workplace mental health and well-being later. But some of the numbers that we've pulled from the LIRA report, both from last year and this year, that about leaving their job, and that's not where we want to be. But toxic work environment, having internet issues of my own, apparently. Can you hear me now? A quarter of employees are considering leaving their job. A lot of the reasons are dependent upon culture. As you can see, toxic work environment was cited, negative effects on their mental health from work, feeling undervalued at work, and even no clear path or of career development, career path where they are going to go within their home organization. And a very high number is 81% of workers were reporting that they will be looking, when they are looking for new jobs, for workplaces that support their mental health in the future. So I know a couple of presentations back, there were questions around when you're looking at an organization, how to know what culture is going to look like when you get there. Employees are looking for that. So those questions, it's important that we provide that guidance to people as they are out in the job search field, looking for places that will really support them, give them a purpose, everything we've mentioned so far today. This is just a look at the negative side of things. So we like to focus a lot too on the role of the manager, and we know how crucial the manager is to influencing their employees on what the company culture, what the goals of the organization are. And they also can get the ear of leadership. So they are right smack dab in the middle and have a lot of impact, have a lot of control. And unfortunately, sometimes that goes in a negative way. I know some of us have, I'm sure all of us have had a boss at some point that has, been the reason that we've left our jobs. We don't necessarily leave the work that we like, but we sometimes leave the culture or our boss. And looking at things such as time management and allowing time away from work, understanding and communicating better, making sure that people are in the right jobs, doing the right work, and that managers are supporting, not just to probably everyone here. Some of the top complaints from employees when they're talking to HR about managers are managerial bullying. They're not feeling psychologically safe at work. They're dealing with very much impacting their ability to get the work done. In terms of work-life balance, workload, reachability, we all know work-life balance, know that understanding what our employees are capable of doing in terms of workload and trying not to exceed that in terms of avoiding burnout. But reachability, one of the bigger problems that we're having as a whole in society, in that we have our cell phones all the time, and just email on your phone, you have your messaging through work. It doesn't mean that your manager should be able to reach you outside of work hours, right? So if employees are feeling like they have to respond every time that they get a message from work, even if it's outside of their 9 to 5 or whatever their shift time might be, that is a lot of stress that can be easily handled if we focus on setting boundaries in the workplace. Lack of guidance or feedback from managers, people want to hear from the people above them. And a lot of these things you're going to hear, again, from Betsy later, a little deeper dive, but people want to know if they're doing the work well. They want negative feedback, but they don't want to be talked down to or berated. Constructive criticism is the way that employees are trying to grow, and managers that aren't willing to provide any feedback or only negative feedback are only going to contribute to that burnout piece and not so much the career growth and development. Communication style obviously is really important. I know everyone knows this, but setting the scene for each of your employees, whether it be as a team or even individually, on what communication works, what communication doesn't work, how they like to communicate, whether it be their email, phone, text, whatever it be. Setting barriers is extremely important, because if your manager is communicating one way and you are not receptive to that, it's not always going to come as positive, even if it is not something that they mean negatively. Competencies, metrics, resources, these are all really important too. And this kind of goes back to some of those pictures on the last slide, but employees want to feel supported. They want to have the resources they need. They are happy to reach metrics and focus on different goals, but those things work that's being done, and that they can rely on them not only as a manager, but even as a guide, as a teacher. It's obviously very frustrating if you're don't really know what's going on. All right. And then looking at the work-life balance, the way that we used to think about it and the way that moving forward is much more beneficial to improving company culture. Instead of finding balance between work and life, looking at work as a determinant of well-being, it's something that is affecting you and your work and your well-being as a person, as a whole. It is not just finding the balance where you can turn it off at the end of the day. Work follows us home, whether we're answering emails or not. It's always going to be in our head, moving from work to our personal life. Instead of individuals being responsible for their own well-being, well-being is a shared responsibility between the organization and the employer. I'm sure during the pandemic, at some point, your colleagues or outside of your colleagues, maybe your family at home, the word resilience was really starting to grate on people's nerves, because they felt like it was a bit of a scapegoat for employers to encourage them to be resilient, but not really focusing on that shared responsibility of the employee taking care of themselves, but also the employer being there and providing the services necessary to do so. And instead of the best solution being the class and the EAP, focusing on the organizational structure and how it impacts well-being. That's managers who are trained in leadership, in conflict resolution, in anything that will help with career growth and development, both for them and for their employees, impacting work in, again, the flexibility that has been mentioned today, like giving, and just making sure that an employee can bring their whole self to work when they can work, and they also feel comfortable talking to someone at work, be able to provide the best work in the end. As mentioned, leadership is a big key. They need to normalize what people are experiencing as employees in terms of their whole overall well-being, communicating about those benefits that are available, about how they care about well-being, even leadership talking about how they do help when.
Hi there. Sorry to interrupt, Shayla, but your internet cuts out every 30 seconds. So I'm going to ask Betsy to take over.
Yeah,
Okay,
absolutely.
sure. Thank you. So Shayla, if you want to move on to the search in general. So I think the point of everything that Shayla was describing is probably what you all already know, which is that the manager matters. And, you know, the old saying, if people don't leave jobs, they leave managers. And so everything that we're focused on is trying to help managers be responsive to what employees are saying. And the search in general did a great report that I suspect most of you have seen. It came out just this past March, and it really gives us a framework to be able to think about the whole workplace culture and framework. So I'm going to spend just a couple of minutes going through this, and I wish there was some way to poll how many of you have seen this, but I don't think we can really do that. Next slide, Shayla. So the first part of it is protection from harm. And obviously that means, you know, physical harm, psychological safety. You know, there's a lot of work that's been done, especially at Harvard, around the whole concept of psychological safety, which really means, are you empowered to take risks? Are you afraid of negative feedback? If you take a risk and it doesn't work, how have you as a manager created a culture that promotes risk-taking, knowing that it's safe? How do you normalize and support mental health? I think the caregiver presentation talked a lot about normalization, and that's really important. And the whole DEI movement is, you know, again, how do you operationalize that so it's not just some word that or some department in your organization, but it's part of everyday operation. And from a work-life harmony, I think a lot of people have already talked about this, so I'm just going to casually mention it. But obviously, autonomy is important. Nobody likes to be in a place where every sentence is micromanaged, and having as much flexibility as possible. You know, I have done a lot of research about the challenges in today's workforce, and the number one issue is remote. So how do remote workers feel engaged? How do they feel connected to the mission of the organization? How does a manager who probably hasn't had training in how to work in a remote environment? I just did some research last week that showed that in 2025, almost 40% of employees will be 100% remote next year. And that's a huge shift. You know, I remember before COVID, when we as a leadership team spent close to a year figuring out how we could give 1 day of remote work, and how that all shifted on a dime with COVID. And now that's part of the work-life harmony that we all have to adapt to. Next slide. So again, that work, knowing that work matters, there's, I think somebody just a couple speakers ago referred to the study, excuse me, about once your salary is at $75,000 and you feel like you can live, that what's really important to you is knowing that your work matters. And how can a manager support an employee connecting the dots between their day-to-day work and the organization's mission? And that can go a long way in engaging and motivating employees. And then how do you create an inclusion? Part of remote working is isolation. And the fact that you don't have the water cooler coffee pot conversations, you can't go out for a walk in the middle of the day with your colleagues. It's a whole different world. And so how do you build in that structure? Even if you're part-time remote, when you're in the office, how do you create a balance of accountability and connection? That's an important area. And then obviously opportunity for growth. Everyone wants to know that they can make the most of their career path, and how does a manager support that? Next slide. So the answer in a lot of cases is training managers. There's a lot of research, again, that supports the impact that a manager has. Yet many managers many employees don't feel like their manager is really able to respond to their needs. But the good news is that when managers do respond, it really makes a difference. And next slide. And we can see, so this again is common sense, but I just read a study the other day that said 23% of employees don't support their leadership, yet 93 do support their leadership when they think that there's transparency, when there's open communication, when there's really growth and opportunity for adaptation, and a true engagement where the employee knows that their manager has their best interest in mind. Next slide. So training is crucial. It's not common sense. I don't think anyone in an MBA program had a class on how to manage people that work remotely. And so it's important that we all pay extra attention to the support and that we are giving managers, especially around tough conversations, and how to really demonstrate. It's one thing to say, oh, I'm empathetic, I'm compassionate, but how do you really demonstrate that on a daily basis? And how do you show that you're listening in the most attentive way? With the best of intentions, we can easily negate what we think we're hearing. So next slide. So so we've created a program here at the foundation called Notice, Talk, Act at Work. It's like, obviously I'm very familiar with mental health first aid, having led it for many years. And I would like to think that Notice, Talk, Act at Work is a very mini version of mental health first aid, and it's totally designed for the managers, although next month we'll be releasing a version that's for any employee. And we're also releasing a Notice, Talk, Act in an industry specific way. So though it'll be specific for any industry, whether it's oil and gas or finance or tech. But basically what we're showing is that by an e-learning 35-minute video, we can teach managers how to notice changes in somebody's behavior, how to feel comfortable talking, and how to know how to act. Next slide. So noticing changes, we talk about the difference between appearance, behavior, mood, and thinking. I think it's pretty obvious to all of you, but the appearance is outward signs, behavior is changes in in a person's behavior. Again, it's the change delta that's so important. And mood, is their mood different? Is it inappropriate? What's their thinking? Are they constantly having intrusive thoughts? Are they having difficulty concentrating? Are they persistently negative? And if that happens, next slide, then how do you know to start a conversation? You don't want to overreact. You don't want to have a conversation when it's really feels like you're meddling in the person's life. So you have to act at the right time in the right place. You have to be, if it is something that you're really concerned about as a manager, you need to make sure that you're not doing it in a public space, but you're finding a quiet area that can demonstrate your one-on-one attention and concern and respecting people's privacy. And making sure that you have healthy boundaries, that you're not saying something that really is an inappropriate thing for a manager to say. And that you know your internal resources so that you can encourage the employee to use what is already available. And that if you see reason for harm, if you're really concerned about someone suicidal thinking or very negative opinions, and if you're concerned, then you need to really realize that that's a time to sound the alarm and be responsive immediately. And I know that all of you know of a lot. There's this whole suicide prevention and suicide action training that's available, but that's obviously another conversation. Next slide. So when you understand this resources, obviously that's a combination of the company's internal resources, whether it's human resources or their employee wellness benefits or employee resource groups, or more external EAPs. And I think you all know that there are a lot of alternatives now to EAPs. And then the community resources. Again, if you're whatever city you're in, it's helpful to know the community resources in that particular community. These are a few of the national resources. Next slide. So we also really emphasize in Notice, Talk, Act at Work that the manager's well-being is so important. The last speaker talked about, when you're on a plane and it's, take care of yourself before you help your neighbor. Obviously, that's true for managers. And so we want to make sure in this training that we give concrete examples of how managers can take care of their own well-being and model that taking care, that self-care to other employees. A manager who says, don't work 24/7, but then the manager's working 24/7, or take a vacation, but I don't really have time to take a vacation. It doesn't role model the kind of behavior that you want to reinforce. Next slide. So that's our overview presentation, and we're happy to answer questions. I'm sorry that Shayla's internet was a little intermittent, so I'm happy to go back to any of her presentation and elaborate on any of those points, and happy to answer any questions.
Thank you so much, Betty and Betsy and Shayla. I think that we heard most of what you said. It was just that the internet periodically did phase out. But please do join us again for the discussion. I don't think there are some tough questions here. I think Betsy's going to be in trouble without your expert input.
I'm sure that's true.
Okay, so I'm gonna start them. One of the first questions is, what if the employee is burned out, but the work stress is a small amount and the personal stress from something at the home, say, is the major problem, but it's sort of showing up in the workplace as burnout. How would you suggest approaching an employee in that situation?
So first of all, I want to point out, a lot of times people equate burnout with a mental health problem, and you can easily be burned out and not have a mental health problem. So I just want to make that clarification. But if it's more personal, I think you have to, walk a fine line of not being intrusive, not getting too into their personal life. But if it's affecting their work, then you as a manager certainly have the right to say, in the most compassionate way, I'm concerned about you. You used to never miss a deadline. You always were first to offer to be collaborative with others. Now you seem a little more stressed out. So I'm just curious if there's something that we can do to support you.
Okay, so it's really building on your principle of notice and then communicate. I might add an echo, as a psychiatrist, I'm regularly called upon to look at individuals and clarify if they actually have clinical depression or situational problems and or burnout. And I appreciate your clarification that everybody who's burned out doesn't have a psychiatric problem. And so, the standard approaches for depression aren't necessarily the right way for handling burnout. So one of the simple ways that whether you're a clinician or whether you're a manager in trying to get some sense of someone who's in distress is, to what extent does this person seem to have some enjoyment when they're away from the stressful situation? So the nature of clinical depression is, you can still be in a pleasant situation. You might be, at home with people you like and, able to do whatever you want. But when you have clinical depression, that your ability to enjoy that time is impaired. When you're burned out, you might initially, when you get home, you might be, glum or something like that, but you can perk up and you are sort of back up to feeling better when you're watching your favorite show or talking with some people you like. But when you go back to the workplace and you're glum again, that's more like, burnout. And, so therefore, that's just a very simple example, but one way to differentiate, is it burnout or is it clinical depression? With clinical depression, it interferes with your functioning, whether you're at work or at home, and whether it's day or night. All right. Well, welcome back, Shayla. The next question is, what about when the problem is actually at a higher level with leadership? And so the leadership are sort of dissing some employees, or maybe they're gossiping, maybe, I don't know, perhaps they're saying that they don't perform well, they're not holding up their end or whatever. Is there anything you can suggest on how one might manage a leader that you report to who is exhibiting bad behavior?
So Shayla, you can think about that. I'll start, but I think, I'm sure we've all heard the expression of managing up. So I think that that's a perfect situation to show that as the employee, first of all, if you're talking about a manager who is in between the leadership and the employee, then the manager can try to be the buffer between and as much as possible. But in a case where it is your leader or your manager, what's important is to be prepared, like know what pushes their button and what makes them okay, what makes them comfortable. Are they just want to constantly know that the work is getting done? Can you send them daily emails so that they're up, they're up to date? What is it that you think? And you can ask them, quite frankly, I want to make sure that you have what you need about my work. So what can I do that will support our relationship?
Yeah, and I think too, as Betsy mentioned, managing up, if there is a manager between you and leadership and they have a little bit of responsibility to look into it and possibly even advocate to leadership that the things
Okay.
that they are saying are not. Can you hear me?
Yes.
Okay. Leadership might not be aware of what they're saying is actually reaching the employee and affecting the employee. So speaking up and advocating for the well-being of employees, sometimes it's the first time that leadership hears it and they need to hear it.
Right. And, I'm reminded that the principles that both of you are articulating actually apply to any important relationship. I'm thinking of a marital relationship, also, that it's important to try and identify what are the triggers for the other person, what are they particularly caring about, and then finding the right way to say the right thing, not as a criticism, but in a way to help the other person I understand that there might be a little bit of a problem here, and the way that you present that or the way that it comes across doesn't have the intended effect. So
What I find is that most leaders don't want surprises. And so to the degree that you can never provide too much information. If you do, I'm sure the leader will tell you, but better to over communicate than not.
So that leads into an earlier question that I did not plant, but it is a sort of a medical question, and that is one of the attendees states that they're a medical professional, and they spend all their time caring for patients during the day, and they have they have to come home and they have other responsibilities, and they were alluding to the caregiver issues, but that they find that their managers and the, at the higher levels, departmental heads, deans of medicine, et cetera, it's very difficult in the medical culture to say that there's something wrong, or to give them feedback that, you're really expecting too much. And, certainly doctors, having historically been well respected and well paid, were basically expected to, put up and shut up. And that doesn't seem to work as well anymore. So any ideas for how, what I'll say are us lowly doctors to deal with our hierarchies?
I don't think I have to say that we didn't plot that question. So we have a program called Frontline Connect that was designed especially for frontline healthcare clinicians, and it's addressing exactly that. We know that, especially I think during COVID and post-COVID, there were such an increase in mental health resources available for healthcare professionals, but they weren't being used, and they're still not being used. And so Frontline Connect is a toolkit that we created that's a combination of interviews of best practices along with infographics that summarize the best practices that say, what can a healthcare system or hospital do to change the barriers that prevent a physician or nurse or anyone in a healthcare setting from accessing help? Are they worried about the credentialing or are they worried that it's going to get out and it's going to affect their patient load? How is the hospital providing special support to make it okay for a frontline clinician to get help?
Yeah, thank you for details of that, because I would say that a lot of healthcare employers are not particularly good employers. And so that if there are programs that can help address that issue, I think that's very valuable.
I would encourage people to just Google frontlineconnect.org and you can find the toolkit.
Okay. Here's a different question. How do spiritual beliefs affect our employees, and how can we support them?
Well, that's a really good question. Actually, I was in a meeting at Methodist Hospital in Houston recently about learning all of their interventions for healthcare clinicians. And they actually have a huge clinical or spiritual program that's part of the array of services. So spirituality is very important. You know, we at the foundation have a separate program that's dealing with mental health and faith, because people often turn to faith leaders and their faith for inner strength. And a workplace needs to acknowledge that in a totally non-denominational way, but recognizing that one's spirituality is an important part of overall resilience.
Okay. Yeah, I mean, I think what you're a larger way or another way of saying what you said, I think, is we need all the tools in the toolbox, and if we can use the spiritual toolbox, power to us, and we need to respect that different peoples of different faiths will have slightly different tools in that category, but that category of tools is very important.
Mhm.
How about here's a more practical scenario. The manager is not willing to really work well with the employee around achieving some work-life balance. So the employee has gone to HR and said, you know, we have a problem here, and HR tries to help inform the manager that, you know, there is an issue and all that. But then the manager's angry and then starts like micromanaging the person, maybe portraying them as a whiner or a complainer and all that. So the manager who sort of retaliates after these issues are brought up, any suggestions on how to approach that?
I think working with HR is important. If there's an opportunity for HR to communicate to the manager's supervisor so that the manager can be coached around the fact that it really is a problem and it's inappropriate behavior on the manager's part. You know, somehow the manager has to change the behavior. And Shayla, any additional comments?
Yeah, one thing that we actually have as a resource here at the APA, I'm going to turn off my video so that I don't break up. One of the resources that we have here at the APA actually as employees is a ombuds person. And so you can speak to this person about any to work. It's completely confidential, but they are someone who can either help you speak with HR about moderating a conversation. They can moderate a conversation between you and your manager. If you think that talking to them will get somewhere, this person is willing to help. So finding some resource through work, it might be the EAP or something, even if you personally just need to talk to someone about pointers on how to talk to your manager. Just looking for resources around you in addition to HR.
Thanks, Shayla. That came across very clearly, and the internet was kind. So for the final question, in terms of resources, so let's say someone wants to get some more training and, you know, or training for managers. There potentially are several, and, you know, you've certainly worked with other organizations, Betsy, and the APA itself offers something. So can you give us a little bit of a sense of, you know, where someone would or how someone would search for training programs for managers?
Yes, so obviously if you just Google, either go to our website, apaf.org, or the Center for Workplace Mental Health.org. Both of those have a way to find Notice Talk Act, and you can just, there's a form that an employer can complete, and then we'll follow up with them and offer it. It's very simple. Obviously, mental health first aid is available. It's more intense than Notice Talk Act. And I'm sure there are other programs available. You know, there are many apps that corporations are offering, and that's another resource. It's not really training as much as it is a resource for employees.
Yeah, thank you for that. And I might say our own program. We have a small program here at the University of Michigan through our workplace mental health solutions, where we offer training workshops for managers that are briefer and again, have some similarities, but can complement some of the things that we heard about from Betsy. So hopefully today we've had a chance to identify some of the challenges in terms of changing the company culture. I think one of the takeaways I'm getting is that communicate. We may have to communicate with senior level. We may have to communicate with HR. It's not nice for the employee to have to take on an additional burden of like, oh, well, reaching out to HR. But you know what? We will not move mountains unless all of us make some effort. So if we are encountering a problem, I think it's important for us to access the people that can help change things. And it may be going to HR. It may be finding a polite way to raise something with someone who's, to whom we report, and take the next step. So with that, we are going to take a 5-minute break, and then again, catch 2 minutes of sunshine or something like that. And then we will be back for the next round of concurrent workshops. Concurrent workshop number 3 will be on this link, the trauma workshop. And in the chat, we will put a link to the other workshop on navigating workplace mental health, insights from the National Alliance for the Mentally Ill, NAMI. All right, see you in a few minutes. Bye-bye.